One clear lesson from the pandemic over the past couple of years is that America cannot be strong without its hospitals and health systems being strong. But their strength is under serious stress right now. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hederle with AHA Communications. Caregivers work round the clock to nurse ill patients back to health. Yet many hospitals and health systems are themselves not out of the woods yet, due to a confluence of economic factors that have skyrocketed the cost of caring for their patients and communities. In this podcast, two American Hospital Association policy experts walk us through the severe economic environment that many care providers find themselves in right now, as highlighted in a new report from the AHA.
I'm Aaron Wozolowski, AHA's Vice President of Policy Research, Analytics, and Strategy, and today I'm joined by my colleague Bharath Krishnamurthy, AHA Senior Associate Director of Health Analytics and Policy. We're going to discuss the release of a new AHA report looking at increases in hospital expenses for labor, drugs, and medical supplies, as well as the effect inflation is having on the continued financial challenges hospitals currently face. We're also fortunate to be joined by Philip Pandolf, President and CEO of Medville Medical Center, a 200-bed independent community health system with 3 acute care campuses and a 32-bed skilled nursing facility serving Crawford County, Pennsylvania. He'll share the real-world impacts that these increased expenses are having on hospitals and health systems. So let's get right into it. Bharath, what were some of the main findings of the report?
Thanks for the question, Aaron. Overall, I can tell you that the report finds that there has been tremendous growth in expenses across the board for hospitals and health systems over the course of the pandemic, but especially over the last 6 to 8 months during the Delta and Omicron surges. I mean, whether you look at labor costs, drug costs, or even supply and equipment costs, everything has increased. And not just by a few percent, but in most cases, these expenses have gone up more than 10 to 20%. Let's just take a look at labor costs as an example. There was a 19.1% increase in labor costs through the end of 2021 compared to 2019. And a lot of that growth is because hospitals are dealing with a critical shortage of employees and have been forced to turn to staffing agencies who have simply exploited the situation by significantly raising their rates. And then on top of that, the country is experiencing historic growth in economy wide inflation that's also driving increasing prices and costs for hospitals. So, in every way, it's just a really tough situation right now for hospitals and health systems around the country. I also want to stress that it's really important to contextualize these cost increases because they've come at a time when hospitals and their staffs have tirelessly served on the front lines of the pandemic. Hospitals have incurred billions in losses and operated in many cases on razor thin margins. Hospitals have dealt with a lot of tough situations and have been extremely resilient, but these cost increases are just truly unsustainable.
Those are some pretty significant figures you just went over. Let's drill down on a few specific areas. On increased labor expenses, you mentioned hospitals having to rely on contract labor and the staffing agencies significantly increasing the rates they charge hospitals. What did we see there, especially during the Omicron surge?
You're absolutely right. Let me start by saying that as many surveys and reports have shown, the pandemic has taken a real emotional and physical toll on our hospital workers, who have been the real superheroes through the pandemic. Not only have they been on the front lines every day caring for patients, but they've done so with fewer staff and resources. And this staffing shortage really hit a critical point during the Omicron surge, as demand for care was very high, and there were about 100,000 fewer hospital staff compared to pre pandemic levels. This is why most hospitals turn to contract staffing agencies to fill gaps, especially for nurses, because nurses are in short supply and are critical members of the patient care team. When we looked at the data at the height of the Omicron surge in January of this year, we found that not only were contract nurses making up a median of 23.4% of all nurse hours worked at the hospital, but contract nurses represented approximately 40% of total nurse labor expenses. This represents a massive increase from pre pandemic levels, where contract nurses only accounted for a median of 3.8% of all nurse hours and 4.7% of total nurse labor expenses. And perhaps more shocking was that at the height of the Omicron surge, the data showed that staffing agencies were exploiting hospital staffing shortages by charging hospitals as much as 62% more than what they were paying the contract nurses. So as a result, staffing agencies brought in record revenues and profits, leaving hospitals to contend with skyrocketing labor expenses.
Yeah, that's really striking. Let's hit on one other area, drug costs. Hospital costs for drugs increased dramatically, more than 28% compared to pre pandemic levels. What are some of the factors at play there?
Yes, as you noted, the increases in drug expenses are staggering and very concerning for hospitals. In looking at the data, we found that there were several factors fueling the massive growth in drug expenses, including the fact that patients coming into the hospital are now generally sicker and are requiring more intensive care than before the pandemic. But one of the most significant factors has been the continuous decision of drug companies to arbitrarily raise the prices of their drugs significantly. Let's take an example. One study found that nearly half of all drugs used for Medicare patients in the hospital experienced price increases greater than the rate of inflation between 2019 and 2020 alone. In fact, the manufacturer of one of the most popular drugs used in the hospital to treat rheumatoid arthritis, Humira, raised the price of the drug by an astounding 21% between 2019 and 2021 in the midst of hospitals serving on the front lines of the pandemic. Some of the other factors that are contributing to the massive growth in drug expenses are first, drug companies' recent decisions to limit the ability of over 2,000 hospitals that participate in the 340B drug discount program to contract with external pharmacies and allow their patients access to critical drugs through those pharmacies. And second, actions taken by health plans and their pharmacy benefit managers to steer hospital patients to third party specialty pharmacies to acquire medications that are necessary for clinician administered treatments, a practice that's also known as white bagging. And finally, hospitals are now bearing the full cost of one of the most widely used drugs to treat COVID 19 patients, remdesivir, which is priced at a whopping $3,120 per treatment. Aaron, the data here is very clear. Hospital drug expenses have gone up tremendously since the pandemic and is something that hospitals cannot continue to withstand among the multitude of other challenges they are currently facing.
Thanks for setting the scene, Barath. Now let's hear what this data means on the ground for hospitals and health systems and their caregivers who've been on the front lines battling COVID 19 for over 2 years. Philip, can you tell us a little bit about your hospital, where it's located, the community you serve, and what it's been like during the past 2 years battling COVID 19?
Yeah, absolutely. Thank you, Aaron. Meadville Medical Center is a rural independent sole community hospital located in northwest Pennsylvania with a primary service area of approximately 86,000 residents. We're the county's largest employer with over 1,750 employees and have over 100 active medical staff in various specialties. In addition to traditional acute care services, we have a robust network of rural health clinics offering primary care for adults and kids, behavioral health, substance abuse, and dental services. We're tremendously proud of our rural health service as they provide care for some of our region's most vulnerable population. Our community suffered significant impacts from the pandemic, as did many rural communities throughout the nation. I would say we're typical of most rural areas, having a slightly older population than average and a higher rate of chronic illness, which contributed to a significant number of hospitalizations and severity of illness we experienced. Thus far, during the pandemic, we've treated approximately 1,600 COVID inpatients and unfortunately have seen over 250 deaths. Over the past 2 years, we've endured a series of extreme and unprecedented challenges at every level of our organization. We experienced multiple patient surges, supply shortages, suboptimal staffing, and a degree of illness far beyond anything we've ever seen. In addition to managing an overwhelming number of hospitalizations, we became our community's primary source for information on disease prevention, education and masking, and good hand hygiene, as well as the importance of vaccination. Our clinicians also reach beyond our organization, offering on site clinical services to independent nursing homes, correctional facilities, and educational institutions. Like most rural areas, vaccine hesitancy was a significant problem in our community. We made vaccine administration an organizational priority, committing a significant amount of resources towards the promotion, education, and administration of COVID 19 vaccine, which ultimately resulted in providing over 50,000 shots to the residents of our region in 2021. As difficult as it was, and despite the numerous challenges we faced, we've never been more proud of our employees, our medical staff, and our organization that went above and beyond to serve our community in such an exceptional way during the pandemic.
Let's go back a few months to the peak of the Delta and more recently the Omicron surges. What were conditions like at your hospital, and what challenges were you dealing with? And were there any unique challenges that came up in those more recent surges?
Yeah, for our organization, the recent surge with Delta and Omicron were the most impactful part of the pandemic. It brought unprecedented patient volumes and extreme severity of illness, which started in October. And then the impacts of Omicron peaked in December, which resulted in another significant patient surge, as well as hundreds of employees being unable to work, mostly due to community exposures, further compounding the situation. It was truly the perfect storm as we dealt with extreme patient volumes in the emergency department, very high acuity in the ICU, as well as our COVID unit, very long lengths of stay with the inability to place patients in the post acute setting, and the inability to transfer patients throughout the region as all institutions were exceeding capacity at that time. Staff were truly exhausted, overwhelmed, and stretched thin due to COVID illness or exposure from their family members. The past fall was undoubtedly the most challenging period in the history of our organization.
We just talked about rapidly increasing expenses and rising inflation. What are you seeing at your hospital in terms of increased costs of labor, supplies, and drugs and other expenses?
Yeah, we've realized dramatic increases in costs for labor in all areas: contract staff, supplies, and pharmaceuticals. The most stunning and significant increases have been in labor costs, agency staffing, and pharmaceuticals. In addition, we've seen the costs of some contract staff more than double and have been paying some clinical specialists over $150 an hour in certain key positions. As for labor costs, we've seen our average hourly rate of pay, which does include overtime and premium pay, increase by 21% over the past 2 years. And we've also realized double-digit increases in some supplies and pharmaceuticals as well.
What are the kinds of impacts that these increases have on your organization's ability to deliver care in your communities? You mentioned before, all the additional responsibilities that your system has taken on in the community as basically a public health agency. How does this affect your ability to continue providing that level of care?
Well, as you know, and has been stated, even in the best of times, we operate on razor thin margins. Unlike most industries that can pass costs along to consumers, we're unable to do that as our reimbursement is largely fixed, despite the rising costs of services. This makes organizations like ours very vulnerable in times of rising inflation and rapidly increasing costs. So it's essential for our organization to remain financially viable in order to continue to provide essential services to our community. And there's no doubt that if the costs continue to outpace reimbursements, we could be faced with some very difficult decisions in the future, such as limiting essential services that are subsidized by the organization or reducing hospital capacity.
So, Congress has provided some relief to hospitals and health systems through the Provider Relief Fund to help providers deal with lost revenue and expenses related to COVID 19. However, hospitals haven't received any PRF dollars to address the Delta and Omicron surges specifically. Do hospitals need additional PRF support or other kinds of support? And what other kind of federal support or flexibility is needed right now?
Yes, we did receive significant provider relief funding and are very appreciative of the support that we received. The funding was essential to our organization being able to successfully respond to the challenges of the pandemic. However, our pandemic related costs have exceeded the funds that we've received. As I conveyed earlier, 2021 was by far the most impactful and costly period of the pandemic, and additional financial support is certainly needed to offset the ongoing pandemic related expenses and to further prepare to meet the future needs of our communities, whether it be ongoing impacts from COVID 19 or some other contagious disease that strains the nation's healthcare system. It's also imperative that we look at long term solutions in workforce and address key shortage areas, as well as to ensure that reimbursement is keeping up with the cost of inflation from federal sources. And it's also key that we continue to mitigate the rising costs of pharmaceutical and, as mentioned previously, support the 340B program, which is essential for us to provide critical services to our community, many that are subsidized through that program.
Well, thank you, Philip, and thank you for all that your system, and your team is doing and has done throughout the pandemic. It's clear that even as life begins to return to normal, hospitals and health systems still face really significant challenges. And with case rates rising once again, and with no immediate end in sight for rising costs, hospitals will continue to need support going forward.
Yeah, absolutely. Thank you very much.